Thank you guys for watching. Make sure you're following me. Tap on your screen and share the live. And for those of you in the FYP, I already know you are there. I know you are there. Don't tell me tomorrow that you are watching me. Jump in. Tap on your screen. All right, where was I? So I was going to talk about, yes, let's look at the brain body disconnect. And we're looking at porn and fertility, right? And I'm going to throw in one more thing as we go in. Good evening, Molly. Hi, Molly. So if you know somebody who likes to watch porn like mad, go and invite the person to come here. Now. Because they will did it. Right. Oh boy. All right. So we're looking at porn and fertility. Is there a connection between them? But again, it is in the direction of the brain-body disconnect that can happen. So, are you ready? Now, it's very important, especially, by the way, we're talking about men. So this is 30 days of male infertility. So this discussion tonight will be more directed to men than women. So women, wait for your time. When I'm ready for you, we will solve your matter, right? So but it will be focused on men, but a lot of things women can learn also. So do you know that this discussion of especially pornography generally is something that most people avoid. People avoid that discussion, but I will not avoid it, especially for those that are trying to conceive. I will not avoid it. We want to hear everything that is possibly wrong with you, right? We will discuss it openly, right? So the question is, can pornography affect fertility? That is the big question tonight. Can pornography affect fertility? Draw your chair closer. Grab your popcorn. No, not grab popcorn. Take a pen and a paper, right? Because you need to write. Can pornography affect fertility? Right? You know, when you look at this question, at first glance, it looks unrelated. Pornography, fertility, what's the connection? Why? Because porn is visual, fertility is biology. Fertility is biology. So what is connecting them? Can pornography affect fertility? Right? So we have stopped tapping. Why? We don't like the gist porn. People hate porn. Religious people. Hey, don't talk about it. Don't talk about it. I close my ears. Right? Please tap on your screen, share the live. Right? You know, modern research and clinical experience are now revealing something deeper about this area of discussion. Yeah, they are. Why? Because when it comes to this discussion, the brain plays a central role in reproduction. You know, I've told us time and time again, everything about reproduction starts from here. Everything about reproduction. Whether John Thomas will erect, it starts from here. Whether ovulation will occur, it starts from here. Whether conception will even happen at all, everything starts from here. The brain plays central role in all that. And anything that disrupts the brain's reward system can directly affect sexual performance, hormonal balance, ejaculation pattern, and relationship dynamics. So anything that disrupts that pattern, that reward system in the brain, all this can go wrong. You see why when people are offended, angry, or they have a perspective of you, they can never be sexually attracted to you. Are you see what's going on? So it all starts from here, right? If you're just joining, please tap on your screen. It's very important. It's very important, right? So the head, what happens in your head influence fertility largely. So I want to introduce to us what I call pleasure chemical, right? Caroline, I see you, right? Pleasure chemical. And because if we don't know what the pleasure chemical is, we will never know we will not even understand the topic. So to understand this topic, we must start from that pleasure chemical, and the word is dopamine. Have you heard of dopamine before? If you've never heard, don't worry. Just know that there's something called pleasure chemical. So all your pleasures is controlled by one chemical. It's called dopamine, right? And dopamine is responsible for motivation, right? Dopamine is responsible for reward. You feel rewarded, right? Whether you did something for somebody, they appreciated, you feel rewarded, that you were successful, regardless, or you knock and you are very happy, it's there, right? So dopamine is responsible for motivation, is responsible for reward, is responsible for pleasure, right? And sex drive. You see what is going on? So when something pleasurable happens to you, maybe you had a good meal, right? Or you were successful in something you attempted, or some level of intimacy, right? What happens is when any of these things happen in your life, dopamine is released, poof, right? So that feeling of pleasure, woo! I had my first kiss today, right? So it's dopamine. Woo! I passed my exam. It's dopamine. Wow, that meal was satisfying. It's dopamine, right? Good evening, Chilove. I see you. Right? So this reinforces behavior. It reinforces behavior. And sexual activity is one of the strongest triggers of dopamine. Up until this point, is it clear? Just type clear in the comment section. Let me be sure somebody's listening to me. After tonight, it's either you leave pornography alone or pornography will leave you. Right? Right? So sexual activity is the strongest natural triggers of that pleasure hormone in your head, right? Because if I don't introduce dopamine to you, every other thing I'm going to talk about will be like, oh, what is he talking about? And I don't want it to be rocket science. It's your body. It's here now, today. So you got to know about it. So what pornography does to the brain? What does it do? What does pornography do to the brain? Right? What does it do to the brain? Who's ready? What does pornography do to the brain? Of course, I know there are some couples who the only way they can knock is when they put pornography on their theater size TV. That's when knocking can happen, right? Get out of here. Right? So this is what pornography does, right? What pornography provides a high intensity and repeated stimulation to that pleasure side of your brain that keep on releasing dopamine back to back, right? You have PID on treatment now, want to get pregnant. I treat the PID first. Get the PID out of the way, then pregnancy will come. Is that okay? So you don't get problem. Right?
This is fertility.
Am I still available online? Let me be sure. Yeah, the network is kind of shaky, but it's fine. But I hope you are following me. So I'm saying that what pornography does, it provides high intensity repeated stimulation. Thank you very much, UD. Thank you very much. I appreciate you. Thank you.
Every heartbeat tells
the network will not steal my shine. They don't burn away. The network will not steal my shine. Right? All right. All of you that are asking questions, just relax. I'll get to your question. But for now, let's talk about pornography and fertility. And I'm sure by the time I'm done, all of you would have run away because you're only asking for yourself. So let's teach other people first. Then we'll narrow it down to you. Is that okay? So that I think that's the way we can make life better. And by the way, if you are not following me yet, I don't know what you're waiting for. And if you have been learning here, you have not dropped a heart me. Why are you like this? Huh? Why are you like this? All right. So where was I? So I was talking about what pornography does to the brain. And remember, pornography provides high intensity repeated stimulation. Yeah? Not like what you get in the real intimacy. No. Pornography offers endless novelty, exaggerated scenarios. Of course, you know that's what they do. You hear mourning where there's not supposed to be mourning. You hear shouting where there's not supposed to be shouting. You see squirting where there's not supposed to be squirting. You see jets. Crazy people. Mr. Tabs is here. Good to see you. You're welcome. Exaggerated scenarios. So you are looking at this thing. Exaggerated scenarios, and that part of your brain you're shooting, pew, 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 dopamine is being released continuously. Say, wow, I want to be like this. Right? Constant stimulation. Right? Now, this leads to that continuous and high spike of dopamine release from here. Right? And over time, the brain adapts to the excessive release of dopamine. That's what the body does. Thank you very much, Mr. Taps. Thank you. The body will always respond and adjust and adapt to any situation it finds itself. So that's basically what's happening when you watch pornography. The brain over time adapts. So, okay, this is the level of excitement that we want to be at. I'm going to peg it there. Right? I'm going to peg it there. Right? So, now that adaptation comes with a problem. Right? With repeated exposure, the part of your brain that receives that sensitivity, right, becomes less sensitive. It's like we're already used to you. We're already used to this pleasure. So the way you would have been excited before, you're no longer excited. Right? For excitement to come, for pleasure to come, the brain requires a stronger stimulation for the same effect. Why? Because you don't use pornography to tear your brain. So now you have found yourself in a place of desensitization. You don't respond to, if you like, with a naked 1 million women in your front, you know go send a message. why you are now desensitized. Some men are in this particular problem. They don't know how they got there. I'm telling you how you got there. Right? So in the simplest possible terms, what used to excite you no longer has the same impact. Full stop. Right? No longer have impact. Up to this point, do you understand anything? Please talk to me. Just type understand in the comment section. Right? Excuse me. Because this adaptation we're talking about comes with serious problem. This adaptation affects real life sexual performance. Right? Because you are using 5 minutes, 10 minutes, 30 minutes to watch what was shot in 1 week. Right? And your brain is just spiking dopamine. Poof, 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 poof. Your brain is adjusting and adapting to the excessive release of dopamine. Now you are no longer sensitive to nothing. Of course, it's going to affect your real life sexual performance. And you see men in this situation, they may experience things like reduced arousal with partner. Right? Partner that used to jump for joy. The thought of her will make your John Thomas go like this. But now she's just walking all over the place. You know, concern you. No be juju be that. Hello, Golden Hive. Golden Hive, I see you. Good to see you. You're welcome. You know, such men may experience difficulty in maintaining erection. In other words, erection will happen, but the John Thomas just cannot stay there. John Thomas will rise and fall. Rise and fall. He does not stay one place. So that is the second thing, right? If you are just joining, you're welcome. Please tap on your screen and share the live. All right. Now, the worst part of the gist, is it worse? For some people, it's gain. For some people, it's worse. But let me just say it. The worst part of the gist is such individual. Yeah, you're welcome. Such individual will have delayed ejaculation or inability to ejaculate. You go to wonder. Say, bro, you don't go ejaculate like this. You guys just knocking 1 hour. 2 hours. You say, my womb has shifted. The same womb that shifted, you shift it back. Well, because it's not ejaculating anytime soon. You know, up until your waist shift from its position. Why? It's already desensitized. Right? Delayed ejaculation or inability to ejaculate. That becomes a problem. Right? Embassy is here. Thank you very much. Good to see you. Welcome, sir. Right? So this kind of problem, right? This kind of problem that some men may face is actually referred to porn-related sexual dysfunction. So that's why it's important people open up to their doctor so that we know what we are dealing with, right? I mentioned like 3 things already. 3 things that can possibly happen. There's going to be reduced arousal with partner, right? Why? Because you don't see porn, your brain don't tear, right? So your partner don't mean anything again, or you will have difficulty in maintaining erection, right? And some people may have delayed ejaculation or inability to ejaculate because of you are desensitized, right? So This is porn-related sexual dysfunction. That's what it is. Because the brain response has been altered by reason of overindulgence. You have over-spiked dopamine in your brain. Right? I hope it's clear. I told you. If you don't know what porn is, you're not supposed to be in a live stream. I'm talking to those who know what I'm talking about. Right? Because this is what it.
This is fertility. This is life. Every journey begins with hope.
My network is kind of slow.
This is fertility. This is life.
Right? So, why does this matter for fertility? All this we've been saying, why does it matter? The reason why it matters is that, you see, fertility depends on regular, effective intercourse, right? It depends on proper ejaculation and coordination with ovulation. So when pornography alters the sexual response, so many things can go wrong. Number one thing that can go wrong is going to be reduce real life arousal. Real life arousal will be distorted, right? A man may struggle to respond to normal sexual stimuli. The thought of your spouse that used to arouse you before is no longer there. The sight of your spouse that used to arouse you is no longer there. Now, this reduces the effectiveness or the effective intercourse during fertile window. It's going to affect fertility greatly. So that's the first impact it does to fertility. The second one is ejaculatory issues. Right? Ejaculatory issues. Some men develop delayed ejaculation, like I mentioned earlier. Right? Some are even unable to ejaculate. But remember, for pregnancy to happen, we need sperm to be present. And how will sperm come if there's no ejaculation? So that is the number two thing that it does to fertility, where ejaculation is not coming, right? So that prevents sperm from being delivered. The third thing that can happen is reduced libido. Why? Over stimulation from watching these acts. Overstimulation can reduce natural sexual desires. What is supposed to be natural feeling is no longer there. You're now looking for something higher, something more exotic, right? So you have less desire. Less desire is equal to less frequency of intercourse. Less frequency of intercourse means reduced chance of conception. Thank you for the follow, Yudi. I'll follow you back. So that's these three things will happen to individuals that desensitize themselves with watching of pornography. right?
This is fertility.
Now, we mentioned dopamine earlier. If you were not here, just watch the video later, right?
This is life.
Let's look at the relationship between this dopamine and hormonal balance. Basically, the long story is that dopamine interacts with the hormonal system, right? And when dopamine spikes, what happens? It influences testosterone regulation.
Every heartbeat tells a story.
You see why there's going to be problem with erection? Hello, Nana Ama. Good to see you. You're welcome. So the rise of the dopamine influences testosterone regulation. And also, it influences prolactin levels. Also, prolactin levels. Do you know what that means? It means that excessive stimulation followed by frequent ejaculation, especially with porn use, may lead to Doctor, you are starting your live stream. Yeah, these days, right? So much to do at the same time. You're welcome. Loveline is here. You're welcome. You're welcome in. Hello. Contelestic. I see you. You're welcome. Right? So I was saying that excessive stimulation by frequent ejaculation because of pornography use may lead to temporal drop in testosterone. So you are not a manly man anymore, right? And it increases prolactin levels. Of course, prolactin levels can rise in men. Yeah, it's not only women that suffer these things. But when there is high prolactin in men, it is associated with reduced libido. Kem, it's the first time. You're welcome. Want to follow me? I learn everything you need to know about fertility. Is that okay? You're welcome. Welcome in. So when there is high prolactin in men, it is associated with reduced libido. You need a few knack. You need a one knack. You need even the make attempt at knacking, right? And that high prolactin also will amount to decreased sexual performance. Somebody that is good at 4 rounds, 5 rounds before is now roundless. He has become roundless. So that's what porn would do. So if you're trying to conceive, don't worry. There's always the solution to all these things. Right? Do you know that porn use often increase the frequency of ejaculation? You know that, right? So if you were in the previous episodes we talk about polygasmia, ejaculating frequently, right? So excessive frequency can reduce sperm count per ejaculation. It also will amount to poor timing, and you may miss the fertile window. It's not you that is trying to conceive. Fertile window should be the key, but now you are missing it because porn don't tear your brain. So the issue is not just the act itself of watching pornography. That's not really the issue, but it's how it alters the pattern of sexual behavior. That is where the problem is. Right? It also has psychological impact, right? Beyond biology. You ask questions when I'm done, right? So stick around. You did gender selection and it failed. Don't worry, you can try again. Try again. Pretty Wendy, you can try again.
This is fertility.
Right? So there's psychological impact to porn use. So beyond biology, there is that dimension of psychology. Pornography can create unrealistic expectation. You have watched pornography. You are seeing they are doing helicopter style, B-12 bomber style, crossing gutter style. So your expectations are high. Unrealistic expectation. I hope you know is real human being that you're going to be relating with. not those actors and actresses that are doing all what they are doing. So that's what pornography does. Altering your sexual pattern. So that is why helicopter state, that's why nobody should watch porn, because you'll be confused, right? And it reduces satisfaction with real partner. You're wondering what I saw versus what I get. Why is what I saw different from what I'm getting? Why? Your expectations are unrealistic. Therefore, you begin to, your real partner does not give you that. Why? Your brain has gone beyond what the real partner can do. That's ridiculous, right? That's ridiculous. This affects consistency. It affects intimacy, and consistency and intimacy are very essential for fertility to happen. Fertility is not by chance, it's by real biology, right? There are deeper and less commonly discussed aspects to this whole issue. You are late today. T Square Edibles is here. Right? This amounts to conditioning of sexual response. Right? You're welcome. Right. So the brain may begin to associate arousal only to a specific visual stimulation. So if it's not helicopter style, you will not be moved. You'll not be moved. If it is not somebody dressed in a very exotic way, you will not be moved. You that used to be moved with wrapper, you see how our generation don't spoil. Before, tie wrapper to the chest like this, they are producing hundreds of children in one family, right? But now, because of all these shenanigans, you tie wrapper and nobody send you again. Okay, your subscription is not working. Maybe you try it again outside the live stream. It may just be network. It may just be network. Right? So try it again after that. Right? So I hope we are understanding. Anyway, if you don't understand, it means that you're not supposed to hear it. So what I'm trying to say, it makes real life intimacy less stimulating. Less stimulating. This is heavy. All right, let me stop here now. I'm going to stop here. Let's take oh boy. Right? All right, so that's very important. Another thing it does, there's also the area of attention and focus, right? Why? Because high dopamine stimulation. Yeah. So if you're just coming, you don't know what I mean by dopamine, so just relax. High dopamine stimulation can affect attention span and emotional connection. Have you not heard people? You must have heard. I think I've heard this many times. That somebody is knocking his real partner, is now thinking of that porn that he was watching. That's nonsense. Because it affects your attention and your focus. So you are tapping pleasure from a virtual source, while the real source is just here. No emotional connection anymore. And that definitely will affect relationship dynamics. It will. So what are you going to do with pornography? Stop it. All right? You know that porn can cause or become compulsive. And when it becomes compulsive, there is the reinforcing of a cycle that is difficult to break. Difficult to break. This one, no be prayer you need. Just understand the biology, and I'm going to help you. Of course, I know people will pray. All the prayer, you still go back and do it again. Right? You know, people don't know. That's why we need to bring the information out there. And I tell you, you will never hear it anyway. Right? Because my arm about too much. Right? So what I was trying to say, there's also the aspect of somebody was asking, is porn directly damaging sperm? Good question. That's actually an intelligent question, right? We need to understand the important distinction, right? If you are just joining, you're welcome. Make sure you are following me. You are tapping on your screen, right? Follow me, tap on your screen, share the live. That's what we need from you, right? So is porn directly damaging sperm? Is a very important question. Now, pornography itself does not directly damage sperm cell in the way that you're asking, right? But it affects sexual function. It affects ejaculation pattern. It affects, what is this one? It affects hormonal balance and relationship dynamics. All these are indirect effects that can significantly influence the outcome of fertility. So the things that actually directly affect sperm are smoking, toxin, stress, and all those things. We talked about them before. But pornography use has an indirect impact, and it is in the area of sexual function, ejaculation pattern, hormonal balance, and relationship dynamics. Maybe when you have good relationship, you go knock, right? you get good relation, you want knock. How it won't happen? So when does all this become a problem? Well, the truth of matter is not all use of porn actually leads to dysfunction. Not all the use, but the problem are more likely. The problem are more likely when it is used frequently or compulsively. Because there are therapeutic use of pornography, right? So that one is controlled and is actually going to benefit you, right? But when you are using it frequently and compulsively, problem number one. When real life sexual performance declines, the real life show has declined. They are not tapping. If you are not tapping, the information you are learning today, I'll collect it from your brain. You will not remember it after the live stream. Is it not me that gives you? I can collect my team back. Somebody said, is that possible? Yes, it's possible. It's possible. It's possible. But don't worry. Maybe when we meet in another live stream, I will tell you how it's possible. Right? Where are we? So I said, the problem that is more likely is not be juju be that. Yes, it's possible. It's possible. But it's not for this live stream. This live stream is about knock and bone. Knock and bone. Knock and bone. That's what this live stream is about. So we need to vex with people for this place. So just tap on your screen, share the live. Let's be friends. That's all. Is that okay? All right, where was I? I was saying that the problem of the use of pornography, you have if it's compulsive, is a problem, right? If it's not affecting real life performance, it's a problem, right? Libido decreases by reason of this use. That is a problem. And of course, ejaculation issues will have definitely developed. So the key in the gist, right? The key issue in this gist is dependency and overexposure. Dependency and overexposure. Of course, there are couples. There are couples who have said that they need a fit knack, right? If they no put on pornography one side. You see, the two of them already get problem, right? The T said, "This is new to you. All right, welcome to my world." There are couples like that. Their morality high if there's no porn playing somewhere. Now, the good news in all this problem we've talked about today, the good news. I love good news. I love good news. So if you're not following me, before I tell you about the good news, follow me now. You can't believe you're seeing. What are you doing here? Your righteousness will not allow you to stay. So before I put the good news down, follow me. Follow me now. The good news. Good news.
Every journey begins with hope. Every heartbeat
The good news of the gist is that first, let's ask the question. Good evening, Leon. Good to see you. Right? Big baby, I'll follow you back ASAP. The good news. Somebody asked a question. Can the effect of porn use that we've listed, can it be reversed? Can it be reversed? And the good news is that yes, it can be reversed. Of course, I know people go for prayers. Some people, they will rub oil for their head, they will dip them inside water. They do all that. I know, right? I know. Religious people do that a lot. But the answer to the question, biologically, yes, it can be reversed. You know why? Because of the way that nature designs the body. The same way the brain adapted to dopamine is the same way it will readapt, reset itself where the stressors are gone. So when the excessive stimulation is reduced, what happens? Right? Dopamine sensitivity gradually normalizes. It's just like taking too much alcohol. One bottle of beer used to get you high. But excessive use of alcohol, the one bottle is no longer enough. You need 3 bottles, 5 bottles, 10 bottles, a whole carton of beer. What happened? How did you get there? Is because your body keep adjusting. your body will readjust if you begin to change it. Thank you very much, Lovely, for the treasure box. So you want to grab a coin from that treasure box and send me a heart me before I collect my knowledge back from you. Right? So the brain has the ability to readjust. So when excessive stimulation is reduced, what happens? Dopamine sensitization gradually normalizes. Natural arousal. It's just like what they do in rehabilitation. So you need to be rehabilitated from pornography. Right? I'm talking to those who are trying to conceive. Because you don't want to use bad habits to look for picking. You know, go walk. Right? Natural arousal begin to improve. Right? Sexual function recovers. So this process may take weeks to months for the reset to happen, depending on the duration you have been in the business and the intensity of use also, right? Because I think I heard a story one time of somebody who would ejaculate 100 times in one day. Man, because of pornography. Yes, remember to check out my channel on YouTube, Dr. Gordon EMB. All the past episodes are there for those who are trying to conceive. When you go there, subscribe. Right? So let's help everybody. So the good news is that depending on the indulgence of pornography and the intensity of the use of pornography, the correction may take time or it may take shorter duration. So yes, you can be rehabilitated. Yes, you can recover from it, right? Of course, people that do that, they cannot have precious sperm because they waste them. Precious sperm is not for those people, right? So I want to give practical approach for those couples that are trying to conceive. Because this live stream is all about you, those that are trying to conceive. Right? So what are we going to do? Follow me. That's number one thing you need to do. Follow me. The next thing after following me is reduce or stop the use of porn. What you see in those videos were acted for many days. Then they compress it in 30 minutes, 10 minutes, 5 minutes. So it is an unrealistic, exaggerated satisfaction that your brain is just firing dopamine. And that response you will never get in reality. So now, because you cannot get it at home, you step outside of the home to go and look for it.
Every journey begins with home.
Then you step outside, even from the outside, you go to 1, 2, 3, 4, looking for that thing you saw. You will never get it because it's an unrealistic experience. So what do you want to do? Reduce pornography use or stop it altogether. Allow your brain to recalibrate. Right? Yeah. Of course, first, April 1st, we are going to have the TTC League for those that are trying to conceive. Better register now. Register now. How do you register? Follow me. Subscribe. Right? So that's how you register. So you allow your brain, as a couple, allow your brain to recalibrate. Because your brain needs some formatting, right? T, you mean masturbation? That's what pornography will push you to masturbation. Masturbation means we amount to excessive ejaculation or oversensitization of your pleasure centers, right? So it's part of everything I'm talking about. So what do you do after reducing or stopping the porn use? The next thing is focus on intimacy, real intimacy, touching of hands, pecks, kiss, cuddle. Leave all those nonsense helicopter B2 bomber style you are looking for. Right? Build natural connection and responsiveness. Right? Build natural connection.
This is fertility.
Right? And unfortunately for some people, they've been at it since when they were teenagers. Since when they were teenagers. River, I see you. Right? So you want to make sure you can rehabilitate yourself. That's the steps I'm giving you. So the next thing you do after focusing on real intimacy, optimize timing. Right? Ensure your intercourse align with your fertile window. Not just the knack anyhow, all over the place. Knacking all over the place. If you don't knack in your fertile window, forget about fertility. You forget about pregnancy. The other one, you are just enjoying your life, which is not a bad thing anyway. Right? And also manage frequency. How often you knack? You know, some people can do 10 rounds in a day. But why that is good for pleasure, there's also a problem with that. Sperm concentration decreases. Right? So avoid excessive ejaculation outside your fertile period. Right? So if you want concentrate your knacking in that 5 days before ovulation. Right? 5 days before ovulation. Knack wetin no good. Right? That is how you guarantee pregnancy.
Every journey begins with hope.
Right? And also
Tells a story.
deal with the issue of stress.
This is fertility.
Deal with the issue of stress. Many use pornography as a coping mechanism for stress or boredom. You see why you should have quality relationships. Right? When you don't have quality relationship, now your phone and pornography becomes your boyfriend or girlfriend. Try stay one place. Is that okay? Try stay one place. Because you need to understand that when it comes to fertility, right? Fertility is not about organs. John Thomas. Vagina. No, it's not all about that. It's about system working together for pregnancy to occur. You need your brain because it all starts here. You need your brain, you need your hormones, you need your reproductive organs. You need even your behavior is part of the journey in fertility. Even your behavior, right? So be smart. Be smart. If you are not smart, you will not always see me to tell you these things. If you see me, you will come and pay. By the way, private consultation is $50. So come to my DM, pay $50 and I'll consult with you. We'll solve your problems. You know how many people have become pregnant for just information? You're looking for drugs. Go and collect it somewhere. I don't have that magic drug, but I have information that will change your story. Right? So I said all that to say that pornography primarily affects the brain and behavior. That's what I'm saying. So what do? Because when that happens, it ripples into fertility. So it becomes infertile and all those confusion that happens. Right? So long story short, let me end because I want to take questions before I go and sleep. I'm not supposed to sit down for a very long time. Remember, I'm supposed to be healthy too, right? So before I go, couples that are trying to conceive, right? Listen to me. Fertility is not just all about it's not just biology. It's not just biology. It's about neurology. It's about behavior, and it's also about relationship, quality relationship. How can you be fighting in your relationship and you expect to conceive? Even the vaginal environment will not accept that sperm. You don't know. Change in temperament also affects the vaginal pH. And if it's too acidic because of feeling sad, feeling heartbroken, it will kill all the sperm there. All right. Having said that, in a world where there's constant stimulation, you want to protect your natural sexual function, right? It becomes very important for you to do that, because conception does not happen in isolation. It's a holistic thing. It happens when the brain, when the body and your relationship aligns. And that's why I'm here, right? So I don't need to give you drugs to get pregnant. Just listen to what I'm telling you. Otherwise, get out of here. All right. If you have question, it's time for you to ask your question. Otherwise, I run away. Welcome in. Oh, is that my favorite grandma is here? Welcome in. Queen Deriba, I see you.